You are listening to the Horse Radio Network, part of the Equine Network family.
Before we get started today, I just wanted to apologize for the less than ideal sound quality in today's episode. It was a challenging tech day, but the conversation was really interesting, so we wanted to bring it to you, warts and all.
What a beautiful day for horses in the morning.
You are listening to the #1 horse podcast in the world. Here's your entertaining look at the horse world and the people in it.
I'm Dr. Allison Marshall.
And I'm Dr. John Langlois.
And you are listening to the special monthly Chi University episode of Horses in the Morning on the Horse Radio Network for Tuesday, July 30th.
Good morning, Horse World. Welcome to our once-a-month look at traditional Chinese veterinary medicine with the Chi University.
So, John, today we're going to welcome our dear friend and teaching colleague at Chi University, Carlos Zamora, who has been in practice, I think, longer than either one of us as far as our holistic practice goes. And Carlos and you and I are going to talk a little bit about EPM cases. Is that correct?
Yes, and actually Carlos was my teacher when I first started 2008. So yes, he's been there longer.
Yep, he was mine too, and I was 2005. So yep, it's awesome.
I think we're going to talk about cases and the disease itself and the multiple ways in which we can approach treatment for that. Is that what you kind of had in mind?
Yeah, well, first of all, thank you so much for the invitation. I feel very honored and happy to join and give my 2 cents of wisdom on this disease, which I happen to see a lot of cases, and I'm sure that a lot of practitioners will have the same. You know, if they work with sport horses and young thoroughbreds, I think it's a high incidence of this disease.
I think you're right, and I think I graduated from veterinary school at University of Florida in 1995, and they were just sort of discovering it then, it seemed like. And it just seems as though in the last 30 years, the more we put it in the box, the harder it is to figure out and to give guidelines to. It seems like it can look like absolutely anything. And so I do think here in Virginia, you know, my colleagues and I diagnose it plenty. And a lot of times we diagnose it by treatment. I don't know what your feelings are with that, but I think we do see it a lot, at least on the East Coast.
Yes, and definitely there is. I will talk a lot about my experience. I don't know if it's good or not, but it seems to have been working with me. I have had good success with caught the disease, what I believe is the disease, quite early, and therefore be able to install a treatment before we get to more undesirable side effects because of the disease, of the progression of the disease, that makes it a little bit harder for these horses to come back to their normal or their desired performance level.
Yeah, I hear you. So in general, for those horse owners that are listening, and I don't know how much it's out on the west side of the United States, but let's just kind of go over what EPM is, what it stands for, what we know now about the parasites that cause it, and all blah, 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 and the treatments that are out there from a Western perspective. Does that sound like a good approach?
That sounds perfect.
Super. So EPM, Equine Protozoal Myelitis. And my understanding is that it can be caused by more than one parasite now, even though Sarcocystis neurona is the majority. Is that your understanding too?
Yes, that's correct. There's another kind of Sarcocystis as well, and the Neospora also being or recognized as part of has been isolated in neurologic cases where EPM is a suspect. We definitely has horses are what they call the final host or the dead end host.
Almost an accidental host, by the way we understand it, correct? I mean, they're not almost an accidental host, really. Horses they're not really a parasite of horses; they're a parasite of other things. And horses just, I think that the opossum is like the number one transmitter, and maybe skunks and cats, because I think, if I'm not mistaken, Sarcocystis, Neospora, and then Toxoplasma. I think those are the three things, with 80% of the infections being caused by Sarcocystis. Is that current, or has there been other information?
Yeah, no, it is current. The Sarcocystis neurona, which is the most commonly agent that cause the EPM signs, the Sarcocystis fegeri. It's the other kind of Sarcocystis, which way less numbers, and the Neospora hugensis is the other one that are the bad guys in this scenario. What I see is in Western medicine, which has been a little bit of a struggle, the diagnosis of it, because the serum, taking blood and sending that to measure antibodies, sometimes can be, in my experience, frustrating, because I have had horses that has come on a negative test, but I have clinical signs. The clinical signs mostly are what we consider neurologic, and it varies from incoordination or ataxia, weakness, may or may not be muscle atrophy involved, depending on what area of the spinal cord is affected, if it's the gray matter or the white matter of the spinal cord. And there are also, sorry?
Go ahead. No, go ahead.
No, and I also some people, especially I've seen horses that has like laryngeal hemiplasia or laryngeal hemiparesis. Some people or some practitioners tend to believe some involvement with those Sarcocystis neurona affecting the spine, and maybe affecting that recurrent laryngeal recurrent nerve, therefore affecting the function of abduction of those arytenoid cartilage. So
yes, and I have found I've just saw or went to a place where they had a case of EPM in a 4-year-old quarter horse, and he's a big dude, but he was very ataxic. All of his ataxia healed, but his facial nerve paralysis, which was very severe, which meant that the right side of his face was paralyzed, and he really had a hard time eating. That never went away. And I would say that in my practice area, one of the most common clinical signs is kind of a change in temperament. I have a lot of people that they might have some subtle neurologic clinical signs, but they feel like their horse has changed temperament. And it's amazing to me how subtle that can be, but how often, we'll treat that and that will create their horse again.
Yes.
So
and that's one of the things that I was gonna mention, because none of the textbooks that you read or see about that talk about EPM, they don't mention that change of behavior, and I've seen that very commonly, especially in the early stages, which I can attribute to what I see on my acupuncture exam. My acupuncture exam, what I have found is a hyperreactivity in all acupuncture points, including Yanling or Feng Long or gallbladder 32. Those seem very, very reactive on horses that have or that I suspect have EPM, and a lot of them. This, yes, John, I can hear you well.
Yeah, sorry, I've been known to be called Johnny Come Lately. Hey, I think Carlos, I recognize what you're saying, and I think they've even given a name to that called immune-mediated myofascial syndrome, meaning that the whole horse is really, really painful and sensitive.
Yes, and I think that must have some effect in their in their behavior, because they're not I guess they're not understanding what's going on. That hypersensitivity of every stimuli or external stimuli makes them behave like that. So,
and you can't use your AccuScan method any longer in those horses.
How do you mean?
Well, and what I find up here in the East Coast as well is that we have Lyme's disease, and that gets diagnosed a lot. And the response to treatment, which is either doxycycline or minocycline, one of the biggest clinical signs of Lyme's disease is a hypersensitivity as well. So it's very interesting that there have been a couple practitioners that I know of, not in my area, but that I know of, that treat them both. They just, when they have a horse that has a hyperesthesia or excessive sensitivity to the world, they'll put them on Lyme treatment as well as EPM treatment, just to try and figure out or fix them without figuring things out. Because sometimes, I think we've talked about, the diagnosis is tough, right? So, we send titers away. They don't come back as conclusive. Really, what a titer measures, just for our horse owner population, when us vets send away a titer, they're measuring the body's immune response to whatever that pathogen is. So they're measuring how much reactivity the body has, and they try to make that an opinion on how much parasite would be in the body. But as you can tell, sometimes you can have a really reactive immune system that might show a lot of reactivity, and who knows how much parasite's in there, or you may have had a really chronic case long term, and the reactivity of the body has been sort of dampened down over time. So I do think that titers are really kind of a tough way to diagnose all of this, and it does seem to be response to treatment.
So Carlos, what do you do in a case where your client, and maybe you have a little suspect of it? Do you recommend that they run a serum test?
Well, John, after the failure in 2 cases in particular that I have now in mind, of having not only that hyper reactivity in all the acupuncture points, but on top of that, ataxic and weakness behind, and starting a muscle atrophy, that to me, all those things are very typical of EPM cases. And in my clinical appreciation, it was EPM, no doubt. But they wanted to, they insisted on doing a blood test, and the blood test came up negative. So my interpretation in that particular case, I think that the horse had a failure in fighting the presence of the parasite. Therefore, it didn't have an immune response to it that we can measure the antibodies. Therefore, the test is negative. So it loses, to me, the effectiveness of it. So in my acupuncture exam, I also use kidney 27. So, and when I do kidney 27 ipsilateral, all that reactivity is gone. So though that gives me a justification of treatment. and based on the treatment, if it's EPM, in 7 to 10 days, I should have a response, a positive response on this. So makes me the need of sending a blood sample necessary for the diagnosis. If they really want to know, I recommend then the CSF, the cerebral spinal fluid test. That seems to be more diagnostic in a positive case.
Yeah, and as practitioners, it makes it tough for us because, where there is no definitive test for the disease, so we have to use our clinical evaluation. Some people don't want to do the CSF for the cost and maybe perhaps a little bit of invasiveness. So we are really challenged to make the right choice. I have some, and we've talked about this before, that really like to go even treat them with something like Marquis or so. Treat the whole farm, meaning that they have the resources to do it, and they do, and that's a whole different scenario. But I find it challenging, and I'm never opposed to getting the test. And maybe there's some association, if the test is high, that maybe there is a higher incidence possible of the parasite, but there's no guarantee for that.
Right. And I think I probably would speak for us here in Florida, as of different than Allison. We don't have many cases of Lyme's disease, so we don't have, or at least in my experience, I don't see any cases where I can have that hyperreactivity in all the acupuncture points with any other condition but EPM. So makes it a lot easier for us here, I guess, in Florida, to approach it that way. Most of it, I would say 95% of the horses that I get with that presentation, and I put them on any drug that kills the parasite, Western drug, and they get better. So
yeah, something I think we should mention to the listeners, that we, as TCVM practitioners, we recognize our strengths and we recognize our weaknesses. So for equine metabolic disease, TCVM is very, very strong and very much more effective than Western medicine. But for this particular disease, we've got to kill the parasite first. That's our first line. Once that parasite is killed, then we can move on to maybe doing some supportive treatments with TCVM, herbal, acupuncture, and all the rest, all going to be helpful. But first thing, you got to kill the parasite.
I agree 100%, and that's the way I approach it. And my I do acupuncture in those horses, and my main focus is to increase the Zeng Qi, or the protective Qi, and Wei Qi. And Wei Qi booster is a herb that I use in a lot of these cases, because, well, if we back up a little bit, a lot of patients that develop the disease, a lot of them are under certain stress, either from transport, treatment, training. Therefore, it makes them susceptible. A lot of horses will get in touch with this parasite, but they don't necessarily develop the disease. The ones that do, most of them are in some sort of stressful conditions, and I want to help and support that. And we have TCVM treatments for it that are excellent. So it's a good complement.
Yes, and I agree. And I think we see that, the stresses of vaccination, or maybe nutrition's not up to par, and Maybe they're using steroids for another disease. So there are some things that go on along with that give a higher incidence of the disease. And it's certainly in our younger athletes. I think one study did 61% of all the cases that they saw with clinical evidence and confirmation of the disease were less than 4 years old. So those and the older than 13, we'll see those tend to have a higher incidence for sure.
Yes.
That's fascinating. So you guys are integrating, you're basically treating the parasites with the drugs and then supportive care with PCVM. I think we should make that clear. Is that what I'm hearing?
Yes, absolutely.
Yes.
And I think
the thought may be that this treatment may need to be for some time because we're using our herbal basically has the ability to kill parasites. It can tonify the body's energy or immune system, but it may need to be used for a considerable period of time, 3 to 6 months, to maybe get that prevention for relapse. That's where I think it has great value. And I think we're somewhere in the neighborhood of 20-25% of horses that are treated for EPM correctly. They're going to fall back at some point within 2 years.
And so my experience is that the herbal formula for the parasites is certainly an important part of the protocol. But I think of the herbs for the immune system, which Dr. Carlos mentioned is Wei Qi booster. I see that as really, really important supportive care. And I think that it's necessary. I think we all learn with Chinese medicine, the herbs are good for parasites. The Western medicine in general is stronger for parasite control, I think, than a lot of the herbals. That's my understanding. And you all can correct me if that's not your understanding. But I think that the Wei Qi booster, which our Wei Qi is our immune Qi. So that's really important in the long term, even when you're treating with the antiparasitics like Marquis and all those others. Is that how y'all see it too?
Yeah.
Yeah.
Yeah, and I think that we know as acupuncturists that we are able to support that immune system function using our acupuncture, electroacupuncture. So we know how.
Right. So it's important for horse owners to know that if their horse is struggling with EPM, that doing acupuncture and herbals just for the immune system can really support the parasitic, the killing of the disease. And it's also really great for recovery of neurologic function. So I'm sure you all have had some great cases, as I have, that if people say, well, we treated him for EPM and he got 50% better. So then we can use our electroacupuncture to both support the immune system so that they don't relapse, also to help start to recover the coordination and the neurologic function in the areas that were affected.
And, I think in another paper, they found that 50% of the horses that went to postmortem exam did not show any evidence of the parasite when it was pretty clinically evident that that's what was going on, even after serologic tests. So a lot of the effects of EPM are inflammatory. So as acupuncturist and herbalist, we can get that immune system plus reduce the inflammation to try to help, because that's what I think is one of the key components. And if I could mention Dr. Siobhan Allison in the Ocala area. I spent 20 years working on this in her business called Pathogens, Pathogenes, and she has a wonderful website to really, if somebody wants to even look deeper. And she's a very big proponent of using levamisole, which is anti-inflammatory, to help get rid of the inflammation that they see associated with EPM.
Yeah, we have a lot of people up our way that use her lab and her products to kill EPM, and they've been really happy with how she diagnoses, how she rules out other diseases, and that treatment protocol of the levamisole and decoquinate.
Yeah. Yep. So the trick is to keep the possums out of the area.
Now, John, you can't say that because I can't tell you how many of my clients over the 30 years I've been here will freak out if they see an opossum anywhere in their barn. And, you know, back in the day, and you guys can correct me if I'm wrong, if you pull, titers on 100 horses, then not on 100 random horses that are non-clinical, then 90% of them have been exposed. So just because the opossum's around does not mean that your horse has got EPM or is going to get EPM. And I also remember back in the 90s, a long time ago, there was a situation where a horse was shipped to Europe and in Europe, and I think it was England, and England doesn't have EPM. And 2 years later, the horse came down with EPM. So the proximity of the diagnosis does not necessarily mean the horse just got infected. Those things can apparently be in their bodies and their intestinal tract and all that sort of thing. And for whatever reason, and probably an immune system reason, then migrate to the spinal cord and wreak some havoc.
Yeah. So there's quite a pathway. Go ahead, Carlos.
Yeah, and I also there was some. I have had quite a few clients and horses that they said, "Well, how can he got EPM? He doesn't go to a pasture." And then I said, "Well, you give him hay, right? Where do you get that hay?" So a lot of times when horses that are they don't have access to pastures and maybe in contact with the possum, but the hay that it was recovered, it could have those stages of the parasite in the hay that they ingest. So it doesn't get them out of the danger, or out of the loop.
Yeah.
Well, and I think food therapy is probably, I think that nutrition, and I love our TCVM, our Chinese medicine approach to nutrition from an energetic perspective. And we can talk a little bit more about that. But, golly, pasture is so important for a horse. It's important for their stomach, as far as ulceration. It's just important for their mind. And it does worry me that people worry so much about EPM that they're not going to turn their horse out, or they're going to try and avoid that. And I think really the approach to both a single case or a chronic case in which the horse has a hard time kicking it, it's really that we need to really help the immune system get over it, if that makes any sense.
Yeah, it does. And, Wendy Ying did a wonderful paper, 2018, and she does list in there a number of foods that could be helpful. So if you would, just 5 or 6 of them, I'll read them off for the listener. Maybe they can make a note. So she mentions that black sunflower seeds, chia seeds, sweet potato, which is high in vitamin E, radish, ginger, and apple cider vinegar. Those are all supportive for immune function and get the body's Zeng Qi up so that they can, again, not have a relapse and keep going on in a good way.
Awesome. Thank you, John. It sounds like a great paper. Wendy is such a great food guru, and she was, started Horses in the Morning, I think, as a podcast, and she's just a great guru as far as horse food therapy goes. I really love all of her information. She's been on our podcast talking about that before. So thanks for bringing her back.
Yeah.
Are there some cases that you've used TCVM that you really felt like it helped a lot? Maybe we should talk about those for a minute or two.
Yeah, well, I think we have, by mentioning it, a lot of the cases that I've treated, they can be summarized with that. Probably 80% or a high percentage of them, what I see is the main complaint is ADR. They're not doing right, and those issues like he's not the one that he used to be. And the other issue that I very commonly see is hirsutism. The hair they look like with lack of luster or in the coat.
Almost
you
wormy looking.
Correct, yes. And then you see this horse come, they have the same deworming program. They have pretty much the same because they're all in the same feeding program. And this horse looks very different than the rest. After treatment, again, took a couple weeks with the Western treatment to kill the parasite, the hair coat looks better. They have they're going back to being their self. There's nothing now that every single stimuli makes them in high alert. So those are most of the ones that I've seen, and the one that has been a little more chronic or affect the gray matter and the spinal cord, then we have a muscle atrophy. Those is when Western, the combination of Western and acupuncture, it's fundamental to recovery because in those cases, Western medicine is a little bit limited in what we can do to help them. With the help of electroacupuncture, hemoacupuncture therapy, hemoaquacupuncture, it works great, and pneumoacupuncture also to get that muscle atrophy resolved.
Why don't you describe a little bit about those? Why don't you talk a little bit about those three therapies and how you use them?
So electroacupuncture would be with putting our regular acupuncture needles, and then we have electro unit, and then we play with our settings to have a high frequency in our acupuncture electroacupuncture units. And that way we can stimulate those the innervation that has been lost to try to recover those nerves, and therefore stimulate that muscle to go back to normal function. That's one way of doing it. Other way of doing is pneumoacupuncture, where we inject in the fascia and the subcu air. In Chinese medicine, this is considered a qi deficiency, in more specifically because it's a muscle involved is spleen qi deficiency, and air. It's in the air is what we call cosmic air, or is a source of cosmic qi. Therefore, by putting air inside the area, we're introducing cosmic qi to resolve that qi deficiency, right? So that's another way to do it. And the other one is hemoaquacupuncture, where we take blood from the jugular vein, and that blood we go and inject it in those in acupuncture points in that area that is affected or is atrophied. If we really, there is some studies done that we can increase the amount of stem cells in those in that collection. If we have the time, we can put an electroacupuncture unit in byway and GV14 to acupuncture points and stimulate for 30 minutes, and 4 hours later, the amount of stem cell has increased fourfold. So therefore the blood that we would use, it will have a more stem cells and better properties to resolve that muscle atrophy.
Very good. So, Carlos, if you have a case that someone that you're dealing with and you suspect that clinically it looks like it has EPM, I think there's 6 different approaches medicine-wise, Western medicine. Do you have one that you highly recommend, or is it based somewhat on perhaps budget or availability? How do you make your choice to recommend a particular Western drug?
Well, I like the ones that kills the parasite. So in that category is Ponazuril, which is Marquis, Diclasoril, which is Protozil, that commercial name, and Toltrasuril, which is Baycox, the commercial name. Those three drugs kills the parasite. I believe the combination of the coconate and levamisole don't kill the parasite, but stop the replication of it, as well as the use of pyrimethamine and sulfadiazine. All those 5 drugs are kill the parasite. To me, those 3 that I named, first one, are my first go-to choices.
Okay, I'm seeing a higher incidence of requests from farms to be using the tolcazaril, which is, I think, the third one that you mentioned, in a compounded way, and seems to be a little bit less painful to the pocketbook, but yet has the same effectivity.
That's correct. Yes. Yeah, I have seen that, and now they compound it, and there are some pharmacy that is compounding Ponazuril, which is a Marquis, and they mix it with DMSO or any other. I have seen it with DMSO, and I don't know what else, but yeah, they try to combine it with other drug, therefore they can sell it and not have problems with Marquis.
Right, and you and I talked about this once before. I have some clients that are very wealthy and high-end horses, and when they get a case, they're going to treat it with Marquis, but they're going to give it twice the recommended dose, which, sometimes we kind of maybe say, well, that may be okay, but I don't recommend, or sometimes they're even giving 10 times the dose, which I think is a little bit dangerous. So sometimes we have to counsel a bit that even though you have the pocketbook, be careful that you follow the recommendations.
That's correct. Yeah, I don't recommend those off-label sort of treatment. I have clients that likes to give the initial treatment, the whole tube of Marquis, which will be enough to. That's 6 times the normal dose, which in one from one perspective, it says to me a good deal of a safety of the drug if they can give it 6 times the dose and not create an adverse effect. So make it quite safe to use. However, I don't recommend to use it that way. I like to use their normal dosage.
Yeah. Well, they did their clinical studies, and it was effective at that dose. So that's sometimes more is not better.
Correct.
Oftentimes.
Yeah.
Yeah, it's unnecessary in my opinion. They're not gonna. I don't think they're gonna kill it any more effective than giving the regular dose, as you well mentioned. In their studies, they have proven that with that at that dosage is effective. No need to do anymore.
Yeah.
Have either one of you used any immune system supplements that were not Wei Qi booster and found that those to be effective? There is a company that just got bought out by SmartPack, from what I hear, named Euclid, or it's UCKELE. And they had an herbal immune product that is now no longer on the market, but I really felt like that helped support the immune system. And I didn't know if there was any other options that you all knew of other than Wei Qi booster.
I utilize my TCVM to do those follow-ups from the Western treatment of killing the parasite. Sometimes many have recommended 5,000 to 10,000 units of vitamin E, as a supportive antioxidant. And I think that's an excellent approach if you so choose to incorporate that in your treatment.
And daily, correct?
Yes.
So, yeah, I've heard that as well.
Yeah, I agree. There is a company, I don't know, I used to have a product called Transfer Factor that I've used in horses with some immune deficiencies with some success. But I haven't used it in a long time. But that's a good product to use. And Western drug, there is Equine. You can also use those in order to boost the immune system.
And I think that we understand that a lot of predisposing factors, why is there up to 89% of the horses test positive to that and less than 1% of them actually get the disease? So that means, again, it's probably an immune function. And I think that we have to incorporate the stressors be gone out of the treatment time so that the horse can, regather it, take it out of work a little bit and, give it some good nutrition, give it a happy, healthy way of being each day to allow the treatment to work and not bring out those factors that might have contributed to what gave the disease.
Yeah, that's an excellent point. Yes.
Well, and as you all pointed out, one of you pointed out that hirsutism or excessive hair growth can come with EPM, but it can also come with Cushing's disease, which is known, or PPID, which is known to decrease the immune system. So not only do we have to look at external stressors, but we need to look and see if there's a concurrent disease process within the horse that's causing an immune system failure, I think.
Yeah,
absolutely. And I think when we do our examination, we have to really rule out other neurologic problems. I know sometimes that can be difficult, but you don't want to tunnel yourself. And my thinking is that EPM is the most overdiagnosed disease out there. And so, we have to kind of look at other possibilities that may be coexisting and or a different neurologic disease and not just hone in on them.
Yeah, I think I've waxed quite philosophically about neck problems. And when I was new, like a baby acupuncturist, it seemed as though I was getting a lot of cases that said the owners would say, well, we treated him for EPM and he got 30% better. And that was always 30%. It was always that number. And I really felt like they had some underlying cervical issues, which may have made the EPM worse. And I'd send them for radiographs and they'd have an old fracture in the neck or some OCD lesions or things that would kind of confirm some neck involvement too. So it's my clients and I talk all the time about how medicine is such a practice. And I think in the realm of EPM, it becomes even more so because it is there's so many potential things that as veterinarians, and especially Chinese medicine veterinarians, that we have a few more tools in our box. We just have to be on our toes all the time and really think laterally and broadly when we're treating any of these cases. That
holistic.
Yeah, right. Holistic with a W for sure.
Yes, and that's a great point. And in my approach when I treat this cases, I want to do a follow up 2 weeks or after 2 weeks of treatment. And by that time, I should have that hyperreactivity in all the acupuncture points should be gone. And if there was, or if there is another disease or another condition involved there, it will be more clear to me to diagnose. And that's why I want to go a second. I want to do a second visit, to make sure that he's responding to treatment and we're on the right track, and B, if there is some underlying condition that I don't want to miss.
Very good.
Well, and it's fascinating to me how things can reveal themselves as we go along, right? We can clear one problem and then you can more clearly see what's underlying. And that's why I think it's a great approach.
Yeah.
Very good.
Super. Well, Carlos, thank you so much for spending your afternoon today talking with us about a case that a disease that affects many horses across the country. So hopefully, some of our horse owners will have taken some good tidbits away. John, thanks so much. I always enjoy the talks that we have and the guests that we have on, and hopefully, we've helped some folks along the way find their way with a pretty frustrating disease.
Feeling is wholeheartedly mutual.
I love it. All right. Well, John, if anyone is interested in contacting Chi University, the website is chiu.edu, chiu.edu. And on that website, there is a spot where you can find a practitioner in your area. And so I'm pretty sure there's a veterinary finder on that website, and you would need to type in your zip code. But that can help lead you to people like John and I that practice acupuncture and Chinese herbals and food therapy and all those sorts of things. So my quote for the July of 2024 is from Nathaniel Hawthorne. And it says, and this is appropriate for our topic today, I begin to suspect that a man's bewilderment is the measure of his wisdom.